Thanks for watching. Today we have Dr. Z, and she is a dentist in Chicago, Illinois. How are you, doctor?
I'm great, thank you.
Awesome. So, can you tell me a little bit about how you got started in dentistry, and yeah, just tell me about your practice.
Well, I started in dentistry. Actually, I got into dentistry on a dare. A friend of mine dared me that I couldn't get into both medical and dental schools, and I took him up on the dare. And he really wanted to get into dentistry, and I was kind of ambivalent about it. And so I applied both to dental and medical schools. I got into both, and he didn't get into dental school, and I found out he's now homeless in Vancouver, which kind of bummed me out. But that's how I started off in dentistry, and then I really enjoyed it after that.
Wow, what a story. So, what's your favorite part about working in dentistry?
You know what? The gratitude from patients when their lives change because of their mouths. I
Mm.
mean, things that really stand out to me, two patients that really stand out. One was a gentleman who was 33 years old, and his he came in with his wife, and on the very first visit he wouldn't even open his mouth. He was so embarrassed. And gradually as I talked to him, I mean, dentists often are psychiatrists, therapists, all
Mm.
in one. And he gradually, with the next visit, opened his mouth so he could take X-rays. He ended up needing all his teeth extracted and implants and dentures. And it was a life-changing moment when he finally got the final denture. His wife was with him. He started crying. His wife started crying. She said, "Thank you. I have my husband back." And
Mm.
I started crying.
Wow.
And then there was another one, an elderly couple also, that at the end of treatment, the husband and the wife kissed my hands and said, "Thank you. You've given us our lives back." And I mean, those are the reasons why we do what we do.
Wow. Oh my goodness. What's your least favorite part about
Least
dentistry?
favorite part? Being told every day I hate dentists. It really
Oh.
wears on you. And honestly, every single day somebody says to you, "No offense, doctor, but I really hate dentists." And it does. It wears on you.
Medical practitioners in general have the highest suicide rates of any profession, higher than the military, higher than police officers, and especially dentists. I'm sure you've heard the stats about that. But why do you think that is in dentistry?
Because it's an intimate part of the body, obviously, and people just are uncomfortable with it for whatever reason, and they just don't like having the procedure done. And so that's the least favorite part for sure.
When it comes to connecting with patients, a lot of physicians kind of struggle to create a sort of barrier where the patient is, it's still a professional relationship, but also a friendship almost, where the patient has a lot of trust. They trust you with their life almost. So, since you've been in business for so long, what would you suggest, younger doctors do to establish that patient relationship, you know, in the beginning?
I think that the main thing is establishing trust. You know, I've always felt that there should be a distinction between professional and personal relationships, because I find, especially when I first started out, um, I was of the mindset that, I have to be literally BFFs with my patients.
Hmm.
And I found that what happened by doing that, and also having that same relationship with my team, my office personnel, um, the respect factor went down because they considered you their peer and not somebody who, even though you had more education, etc., not somebody that they could look up to. And that was a huge uh, negative. And when I switched practices, that's when I saw that no, that's not going to work, that I have to maintain um, a certain distance from patients. Obviously, you're going to have some patients who are your friends and all of that, that I have to maintain a certain distance from patients in order to keep that professional relationship. If you're drinking buddies with somebody, uh, you know, it definitely changes the relationship.
Hmm. But it's not like that's you as a person necessarily. Like it's not like you don't like them or there's a weirdness
No,
in the relationship.
it's not that. It's just that it definitely changes the dynamic.
Mm,
Is what
okay, that's a really good answer. Got what you're saying.
the other thing too. I find when I personally, um, the physicians that I have chosen or the physicians that I have gone to, I always ask the doctor, who would you go to, or who would you send a family member that you like uh, to? I don't care who your golfing buddy is. I want to know who you personally would go to, because that
Mm,
is the difference between, somebody you're golfing with, you may not want to go to as a physician because he's a crappy physician. Or, a lot of people judge physicians or dentists or healthcare professionals on the basis of their personality. Their personality, and they're not causing them pain. Okay. I can tell you that I know a lot of dentists, a lot of physicians that have great personalities, but I would not even send my dog to them to be treated.
mm,
So, a great personality, I'd rather go to somebody who has zero personality, but is an excellent clinician, than somebody who has a great personality and is a crappy doctor.
mm. Is there a way, like over the years, is there a way that you've been able to tell, like when a patient's online and they're searching for a doctor and they're reading reviews, how can they differentiate between those really well branded but crappy physicians and the good ones who
Well,
are
I think
introverts?
what happens over the years, as far as who I refer patients to, um, I I'm very selective about who I refer patients to, and have referred patients to, and it's always somebody that either I or a family member have tested out first. Um, it's also somebody who I may know their clinical skills because I've seen the work that they've done, and
Mm,
that makes a huge difference. So bottom line is again, asking, not necessarily asking your friends who they would go to, but asking your physician that you trust, and that you've developed a trust with, who they go to.
okay, so in business, usually the entrepreneur struggles in four areas, and those areas are money, time, people, and passion. And so, what would you say is the greatest struggle in dentistry for your practice, and then just in dentistry as a whole?
You know what? It's been the money aspect, except ever since I've been leveraging medical benefits for patients for their oral treatment and their dental treatment. It's a non-issue.
Mm,
Dental insurance is a joke. It's been the same. I've been in practice for 40 years, and for
40
40
years.
years, the calendar year maximum on dental insurance has been $1,000, $1,200, $1,500. It hasn't changed, yet premiums have gone up tenfold. Our fees have gone up between 5 and 6 times what they were when I first started. And for example, I mean, a simple cleaning, when I started was $25. Now it's $125. So, dental benefits also have become more restrictive in what they cover. We used to be able to do x-rays once a year. Now you can only do full mouth x-rays once every 5 years. A crown you used to be able to replace if necessary every 5 years. Same thing with the denture. Now it's one benefit, lifetime. That's it. And everything else is out of pocket. So dental insurance is such a joke. And what I did was I said to my patients, you know what? Set up a health savings account. So rather than having those premiums go to dental insurance, and when you look at your paycheck, you're having about $50 per paycheck deducted. So $50 times 26 paychecks comes to $1,200 for $1,000 worth of benefits. How is that even worth it?
mm,
Mathematically, it makes no sense. And so you take that same $50, $100 a month, and you put that into a health savings account. Now, what that health savings account does is, not only is it tax-free money, which means it reduces your tax burden, your gross income, but also the money in that health savings account accrues interest. it also rolls over from year to year tax-free. So it's not a use it or lose it account. And you're able to use it for any type of health care treatment, whether it's dental or medical, for deductions, for copays, all of that. And so with the leveraging medical benefits as well, medical covers a whole slew of procedures, everything from exams to consults to x-rays, periodontal treatment, surgery, implants, bone grafts, tissue grafts, appliances for sleep apnea, TMJ, trauma-related services, all of that I bill to medical. I don't use the dental insurance because most patients that I treat now have gone off the dental insurance completely and have set up the health savings accounts.
Wow, that's a great idea. That's really interesting. I never knew that. Outside of dentistry, what do you enjoy the most?
I do a lot of volunteer work. I volunteer with the Chicago court case dogs, which are dogs that have been neglected or abused or have been involved in dog fighting. So those dogs, about 85% of them are pit bulls. And people have such a wrong perception of pit bulls because I've been doing it for 7 years and not once have I seen an aggressive pit bull. And again, these are dogs that a lot of them that were trained to fight, and they are not aggressive. So it's been an eye-opening experience there, and I've actually fostered pit bulls as have my son and daughter as well. I volunteer with the Avon Walk for breast cancer, although they canceled the Avon Walk last year. I don't know why. I think it was just there were just too many breast cancer walks. I volunteer with the Toys for Tots and also Habitat for Humanity.
What's a successful life for you?
The main thing is, I would say to anybody, and I didn't believe this when I first started out, but the bottom line is it's not about the money. If you're doing what you're passionate about, and sometimes not even passionate about, if you love what you do and you have a greater goal in mind, the money will follow. So my big focus right now as far as business goes is training other offices, and I've been doing this for 26 years now, training other offices and accessing and leveraging medical benefits for patients, because it's a game changer. Patients that were unable to afford treatment because they did rely on their dental insurance, $1,000 a year maximum, $1,200, $1,500. With medical insurance, there are no calendar year maximums. There are no lifetime maximums. And other than TMJ treatment, surgical treatment, there are no procedure maximums for procedures that are done in the mouth. So it's a win-win for everybody. And when you're looking at treatment that is $20, $30, $40, $80, $100,000, you're able to get the vast majority of it, other than the deductible, covered under the medical plans.
Wow. Wow. I don't think a lot of people know about that. Like, I don't think a lot of people know how that works.
There's a lot of ignorance, and I think a lot of it has to do with the fact that it's not addressed in dental school. It's not addressed in medical school. Physicians certainly don't know about it. My brother's a physician, and when we graduated, he actually said to me, dentists know more about the body than physicians know about the mouth. And it's absolutely true.
Wow.
Yeah, as far as medical benefits go, most dentists don't know about it, or they think it's illegal. They think that only a physician can bill medical plans. And that's a huge misconception, because it all boils down to, if the diagnosis and the procedure combination are covered under the patient's plan, then no matter who the healthcare provider is, as long as they're trained and licensed to do the procedure and perform the treatment, it's covered.
Where can viewers learn more about you?
People can reach me at thezgroupllc.com, and that's where all the information is regarding the courses, the programs, the meetings I'm speaking at, etc. Or they can fill out the contact form and contact me that way. But ultimately, leveraging medical benefits is definitely a game changer for any office, no doubt about it.
Well, thank you so much for doing this interview with me.
My pleasure. Thank you.